Hello and warmly welcome to this oral presentation of my abstract that is named 3D Tooth Movement Adjacent to Single Anterior Implants and Aesthetic Outcome, a 14 to 20-year follow-up study. My name is Nicole Winitsky. I work as a specialist in prosthodontics at the Folktandvården Institutet in Stockholm, Sweden, and I'm also a PhD student at the Karolinska Institute. So the background for this study is that we know that single implants end up in infraposition due to the continued facial changes. These changes occur mainly in the lower facial structures, and it's also known from before that the changes of the hard and soft tissues are expected in the face all throughout life. The aims of the present study is to report three-dimensional movements of teeth adjacent to single anterior maxillary implants. It's also to further explore the potential associations between this infraposition and patient characteristics and aesthetic outcome of the treatment. So at the 14 to 20-year follow-up, 32 patients with 32 implants in the anterior maxilla in position 1-3 to 2-3 were examined. They were 18 males and 14 females. The cause of tooth loss was agenesis and trauma. The age of crown delivery was 21 years, and the mean follow-up time was 16.5 years. All the patients in this study had received Brånemark implants with the machine surface. On top of this, they have received Cera 1 abutment with alumina crowns cemented on top. The delivery of the prosthetic reconstructions occurred in 1996 and 97. So at the 14 to 20-year follow-up examination, a clinical examination was performed, including photos, impression for study models, and intraoral radiographs. We also performed an aesthetic assessment, which was performed by both the patient and the examiner. So infraposition occurs due to the maxilla and the anterior teeth moving in an inferior-posterior direction. This makes the implant that does not move according to the adjacent teeth to end up in a more cervical position and also in a more buccally tilted position. So what we had the possibility to do in this study was that we had the baseline study models from 1996 and 97 that we can now compare to the follow-up models from the 14 to 20-year follow-up examination. What we did was that we superimposed the study models in a digital software. And by using the implant as a reference, we could then measure the movement of the teeth adjacent to the implant. So the tooth used for measuring was the tooth mesial to the implant, and the direction measured was the mesiodistal movements, the buccopalatal movements, and also the incisal movements. The characteristics that we used to compare with to find the associations with the infraposition was facial type. The facial type can be divided into the long facial type, the neutral facial type, and the short facial type. We also looked at the lower anterior facial height of the patients, and the patient group was divided into two, with patients with less than 70 millimeters and patients with more than 70 millimeters. We also looked at the age at crown delivery, the sex of the patients. We also looked at the position of the implant, which can be either incisor, lateral, or canine. We also looked at the implant occlusion, the cause of tooth loss, and if the patient had previous to the implant treatment undergone any pre-prosthetic orthodontic treatment. And we also looked at marginal bone level changes that had occurred during this time. The aesthetic evaluation was performed by using the visual analog scale. And the question, how satisfied are you with the aesthetics of your or the patient's implant crown, was answered by both the patient and the examiner. The answer was plotted into this scale between 0 and 100, where 0 was not satisfied with aesthetics at all, and 100 was fully satisfied. So moving on to the results, we found that tooth movement in 3 dimensions was found to be between 0.2 and 2.5 millimeters in all 3 dimensions. If we move on to look at only the incisal movement, we found that 30% of the patients had an adjacent tooth movement of more than 1 millimeter. Further, we also found that teeth adjacent to implant in central incisor position showed an adjacent tooth movement of 0.5 millimeters, while teeth adjacent to implant in lateral incisor and canine positions had a mean tooth movement of 1 millimeter. The result of the aesthetic evaluation showed that 63% of the patients scored the aesthetics of their implants as above 80 on the visual analog scale. And this is despite that all of them have some kind of infraposition. Looking at the dental evaluation, only 20% were scored over 80 on the visual analog scale. So to conclude these results, we have found that 100% of the implants end up in infraposition after a follow-up time of 14 to 20 years. Lateral and canine implants show a greater infraposition than central incisors, and the majority of the patients are pleased with aesthetics. The patients are also more satisfied than the dentist. Looking at the infraposition in correlation to the patient characteristics, we found that age, sex, and facial type was not reliable predictors for future infraposition. We did, however, find that less tooth movement was seen in patients with a lower anterior facial height of less than 70 millimeters, where the implant was in occlusion, and also where trauma was the cause of tooth loss. And with this, I would like to thank you so much for your attention. Thank you.